Hello, my name's Lisa Diaz. I'm a mum from Wigan and also one of the founding members of SafeEd for All. And for the best part of 2 years, we've been fighting tooth and nail for schools to be made safe. So here's a compilation of different people telling us why it's so important. Thanks for watching.
My name's Sarah and I'm from Nottingham. The pandemic caught me on a break from teaching with our third child, and I've been remote educating our children since March 2020. Between September 2020 and April 21, we were threatened with fines, prisons and ankle tags for remotely educating our children. This was despite providing evidence of all the work they were doing and having a vulnerable member in our household. In April 2021, we decided to remove them from the register. We wanted the children to go back and we thought changes had to be coming soon, but the threats of prison and ankle tags was just too much of a strain. And with Delta on the horizon and mitigations about to be reduced in schools, it didn't seem like change was coming soon enough. I can't believe that 20 months into a pandemic, schools are still unmitigated. Vulnerable families are still being bullied into school and there's no sign of change. We're a global outlier in all the worst possible ways. Schools are completely unmitigated. There's no improved ventilation, masks, vaccines are slow to roll out. It's just unfathomable and it looks set to continue. My friend in Canada has got options of remote education as well as mitigations in the classroom. She says around 25% take up the offer of remote education. The only reason I can think that they didn't offer it in this country is because you take out that many children, herd immunity could no longer be a plan.
My name's Sarah Saul. I'm not an epidemiologist, a virologist, a healthcare professional. I'm simply a mum and one of the founders of SafeEd for All. All we've ever wanted, all we've ever asked for, is that in-person education be made safe, sustainable and fair to all throughout a global pandemic. It's happened elsewhere. It could have happened here. The simple messaging could have been, COVID is airborne. Everyone, regardless of age, gender, sexuality, ethnicity, occupation, can contract. Everyone can transmit. And don't forget that nobody can guarantee with this novel virus, which is not yet fully understood, nobody can guarantee how your body will react to an infection. Had those three simple things been communicated to the public, we wouldn't be in this mess right now. The Department for Education has failed twice, 2 separate academic years now, to issue guidance to schools that is based on scientifically recognised infection control principles. It's not rocket science. It has been done elsewhere. We have been left, our families, our school staff and our children have been left to unnecessarily and knowingly be infected. This is not right. This can't continue. This has to stop.
Speaking as someone who's been following the COVID situation in the UK very closely over the last 18 months, and as a father of 2 children, I've seen firsthand how much our kids have sacrificed over the last 18 months. They've had their schools closed, their opportunities taken away, their education has been continuously disrupted, their social interactions have been limited, and their support networks have been damaged. And that's not to mention the human cost of having loved ones taken away by this terrible disease. This is why I find it so appalling that we are effectively leaving children alone to face COVID on their own in schools. We're not even doing the basics to mitigate spread and to make schools safer. And over the last half term, we've seen the consequences with hundreds of thousands of children catching COVID, getting ill and having their education disrupted again. While such a high proportion of our school-age children remain unvaccinated, we need to be doing more to reduce the chances of our children getting infected with COVID in schools.
Hello, my name's Hilda Palmer. I'm from the Greater Manchester Hazard Centre and the Hazards Campaign. Government policy is deliberately killing, sickening and disabling people, especially our children. It's all wrong, it's unnecessary. COVID is a preventable disease, and good public health, good infection prevention and good science tells us what works to prevent COVID transmission in schools. Better ventilation, 10 litres per person per second minimum, supplemented by HEPA filtration. Source control masks for everyone, everywhere in schools, and PPE too. CO2 monitors to warn when ventilation is poor and the risk of inhaling COVID is high. Government policy of fake science, fake herd immunity, false dichotomy of profit before people is a disaster. It's criminally negligent and it's causing social murder or corporate manslaughter. The government must stop this vile biological warfare in schools and protect children, staff and all of us.
This is a letter from Wigan Council. As you can see, there's the Wigan Council headed paper, basically saying if I don't send my daughter into school where there is COVID already, that I will face court proceedings. I can face a family court, which is particularly malicious because it implies there's a welfare issue, like I'm neglecting my daughter or she is under threat or something like that, and legal proceedings where I can get fines of up to £2,500. And this is because I am keeping my daughter out of school and I am teaching her remotely until it is made safe. That schools aren't safe is not a matter of debate. In fact, if I wanted to spread an airborne virus around through a population, I would stick 30 odd unvaccinated bodies in a confined space, in a classroom, without masks, without social distancing, with inadequate and unmeasured ventilation. Open a door and window, weather permitting, it is not enough. It's not enough against Delta, it's certainly not enough against Omicron. I would not isolate close contact, so your child could be sat next to a child whose sibling, mum or dad is poorly, is at home with COVID. All of these things is creating a perfect storm for the spread of COVID. Now you might say, oh, but it's only the sniffles in kids. That is absolutely wishful thinking. Chris Whitty said it's not a benign illness in children. Fauci said children need to be vaccinated for themselves, not to protect other people, well, that as well, but to protect themselves. We've got 80,000 children living with long COVID in the UK. 13,000 of these children have been poorly for over a year. 115 children have died throughout the course of the pandemic of COVID in the UK, and there is nothing being done about it, nothing whatsoever. So this attack on a vulnerable mum, I don't think people realise how serious and how cynical it is. You know, it's like the expression, isn't it? First they came for the socialists, but I was not a socialist. And then they came for the Jews, I was not a Jew. And then they came for me, but there was no one left to defend me.
Hello, my name is David Tomlinson. I'm a hospital consultant and a founding member of Fresh Air NHS, a group campaigning for better protections against airborne transmission of SARS coronavirus in healthcare settings. I support the Safe Ed for All campaign, that in-person education should be safe, sustainable and fair to all during the SARS coronavirus pandemic. We know how this can be done. Other nations have made in-person education for children safer through a multi-layered strategy of face mask wearing indoors, useful to limit virus release during breathing, speech, singing, shouting, all the stuff kids need to do at school, improvements to ventilation standards and using high efficiency particulate air filter units, HEPA, where necessary to clean the air. A reduction in airborne virus leads to a reduction in the risk of infection. And vaccination. Fully vaccinated kids, that's 2 doses, are far less likely to get infected. And of course you can only transmit SARS-2 if you're infected. There's a huge amount to gain through introducing these measures. I shan't go into the numbers of children predicted to be affected by long COVID, hospital admission, paediatric intensive care admission and even death, because they're truly horrific. But it's not too late for our leaders to act. Please help make our schools the safe places our children deserve and need. Thank you.